Welcome back, everyone. Today we're diving into the exciting world of nursing implementation where care plans actually come to life. This presentation will showcase how you can deliver effective patient-centered care while hopefully having a little bit of fun along the way. Let's get into it. Nursing implementation is all about putting your care plans into action. It's that phase where you help patients achieve their health goals, whether that's promoting wellness, preventing illness, or supporting recovery. Think of it as the doing part of nursing. The main goals of implementation are to promote self-care, adapt care plans based on the patient's response, and document everything. Remember, if it wasn't documented, that means it didn't happen. This ensures continuity and quality of care. Hold up! Before we dive much deeper, I want to let you know in an upcoming video, we're going to tackle one of the most important but sometimes tricky parts of nursing, and that is documentation. We'll discuss what you should document, what you shouldn't document, and how to do it like a pro. Stay tuned because you won't want to miss this one. To implement care effectively, you need a mix of skills. You got to get these right. Number one, critical thinking, which is the cognitive aspect. You got to know what you're doing. Communication, which is the interpersonal aspect. You need to know how to talk to everybody involved. And hands-on skills, this is the technical aspect. You need to know how to do what you got to do, okay? And of course, adherence to ethical and legal standards. You got to do it right, okay? These competencies ensure safe, effective, and compassionate care. To implement the nursing care plan effectively, follow these 8 steps. Number 1, reassess the patient. Get into that habit. Secondly, be competent and confident. Thirdly, you want to approach with care. You also want to be able to modify as needed or change the care plan as needed, align with the scope of practice, be able to consult for better alternatives. You also want to get into the habit of developing a range of skill sets. And lastly, be able to partner with the patients and their families for a much successful outcome. You know, many factors influence how care is delivered. These include the patient's willingness and their cultural background, your expertise and the time, the available resources, and professional standards. Now, once you understand these variables, they can help you adapt and provide a more personalized or individualized care for the client. Reassess, reassess, reassess. Yes, you must reassess. This is critical because patient conditions can change in a snap of a finger. Listen, always check if your interventions are still needed and if it's effective. This ensures your care plan stays responsive and patient-centered. Now, sometimes patients don't always follow the care plan as we would like them to. But instead of labeling them as non-adherent, or it used to be non-compliant, you want to dig deeper, okay? You want to ask certain questions like, are there barriers like cost? Maybe there's a lack of support, or is there some type of misunderstanding? So what you want to do is work with the patient to modify the care plan or address any underlying issues. Once you address these issues, you'll find better ways to help them succeed. Delegation. Now, this is a skill that every successful nurse needs. Delegation is about assigning tasks to the right person while you are ensuring patient safety. Listen, every great nurse has to follow these 5 rights when it comes to delegation. They are the right task, right person, right circumstance, the right direction, and definitely the right supervision. Never, ever delegate beyond someone's competency. You hear me? Delegating safely ensures patient care remains efficient and effective. Let's talk about the 4 main types of nursing interventions. They are direct and indirect care. Secondly, you have independent and collaborative nursing interventions. Then there is protocols and standing orders and care bundles. Let's talk about them. Direct care are interventions performed through interacting directly with the patient. Examples of direct care could be something like administering medication, performing wound care, or providing emotional support. while indirect care are interventions that are performed on behalf of the patient that do not involve direct interaction. Examples of this include documenting care, coordinating services, or managing care environment. Independent interventions are actions that the nurse can initiate on their own without requiring orders from other healthcare providers. Examples of this include patient education, routine monitoring, and basic comfort measures, while collaborative interventions are those that require teamwork and coordination with other healthcare professionals, such as developing a care plan with the physician, consulting with the dietitian, or working with physical therapy. Protocols are detailed written plans for managing specific clinical situations. They basically guide nurses in providing consistent, evidence-based care. An example would include protocols for managing chest pain or even sepsis. Whereas standing orders, these are the type of pre-approved orders that nurses can implement without needing a physician's immediate approval. They are often used in emergencies or routine situations such as administering vaccines or ordering lab tests. Care bundles are a set of evidence-based interventions that, when implemented together and correctly, they can significantly improve patient outcomes or results. They are typically used for specific conditions or procedures. Examples include bundles for preventing ventilator-associated pneumonia or central line infections like a Udall cath or a CVC line, or something like CARDI, which is catheter-associated UTIs, for example. A, listen to me and listen to me well. You can't pour from an empty cup. Self-care for nurses is essential, very important. So you want to practice stress management, build support systems, and maintain your emotional well-being. A healthy nurse is better equipped to care for patients and model good health behaviors. When you're at your best, you can give your best to your patients. Reflection. Reflection helps you grow as a nurse. After every shift, there are certain questions you may want to ask yourself, like, did I make a difference today? What went well? What didn't go too well today? What could I improve on? Reflective practice helps you learn from every experience, and it only makes you a better nurse. Let me give you a couple of nursing fun facts. Did you know that nurses walk about 4 to 5 miles per shift? So we getting our steps in, whether we want to or not. Nursing is also the most trusted profession in the United States. And here's another fun tip. Humor, it can actually be a therapeutic tool, so you ain't gotta be grumpy all the time on the shift. Laughter really is the best medication. Nursing implementation is where the magic happens. It's both an art and a science. So I encourage you to stay curious, stay compassionate, and definitely stay competent. Remember this, every action you take makes a difference in someone else's life. Make sure it's a positive difference, okay? You got this. Go out there and shine bright like a diamond, like Rihanna would say.